Today I'm going to be talking about Marfan syndrome and its effects on connective tissue. Marfan syndrome is a genetic disorder that affects one's connective tissue, which is the tissue that supports and anchors the organs and other structures of your body. Marfan syndrome affects growth processes and functions by making it rapid and irregular. The major organs and systems that are affected are your heart, your blood vessels, and your skeletal system. Marfan syndrome is caused by a defect in one's genes. Marfan's is the mutation of the FBN1, fibrillin 1 gene. This gene is responsible for producing proteins that build and make connective tissue strong and elastic. So the gene also gives instructions on how growth should be. So without the gene, growth becomes irregular and your tissues are weaker. About 1 in every 5,000 people are diagnosed with Marfan syndrome, male and female of all races and ethnicities. About 3/4 of people that have Marfan's inherit the gene from their parents. Some symptoms of Marfan syndrome include overgrowth of bones, curvature of your spine, indentation of your chest wall, dislocation of the eye lenses, retinal detachment, pneumothorax, and cardiovascular problems. So as you can tell, this woman has eye problems. Her eye is dislocated. Her limbs are extra long with a short torso. Her fingers, legs, and arms are extremely long, and she's probably super tall. The second picture is the aorta. With Marfan syndrome, the aorta is enlarged to an abnormal rate. So some outcomes can be very severe. So if your aorta ruptures, it can be fatal. A pneumothorax is when your lung collapses. This can be treated by inserting a needle or a chest tube in between the ribs to free the excess air that is released into the abdomen. And another outcome of one of the symptoms is scoliosis. It can result in severe back pain and breathing problems and others depending on the severity of the symptom. So this is just a picture of somebody with back pain, and then this is what a normal lung looks like versus a collapsed lung with all the air inside of the rib cage. People who don't have Marfan syndrome have a high abundance of the fibrillin gene. This allows their connective tissues to be strong and more elastic, connecting all of their organs and other tissues together as it would normally be. So their organs and skeletal system work like they should. So they don't experience any symptoms. They could, but not related to Marfan's. The symptoms are not because of the lack of the fibrillin gene. So this is somebody that has Marfan's. He's tall. It was like the other picture, tall, long fingers and legs and arms. So on the second picture, you can see the difference in one's spine. The second one is the one with scoliosis, and you can tell because of the curvature of the spine. And then, here are just some small differences between the person that has a normal gene and person with a mutated gene. So possible treatments include medication that reduces blood pressure and prevents the aorta from rupturing, surgery for their skeletal issues, or aortic repair or eye surgery, and therapy for vision correction and physical therapy if they have back issues and stuff. There currently is no cure for Marfan's, but these treatments help the patient live a more normal life. So these are just some images of the treatments that are possible. The medication here to monitor blood pressure, fixing the ruptured aorta, and spinal rods to align someone's back. Those that live with Marfan syndrome have to live a careful life because they are at more of a risk than people who don't have Marfan. So they have to be aware of their surroundings just so that they don't end up in a fatal or deadly situation. Other things they have to deal with are being bullied, which happens because they look different than other people. So that is my presentation. Here are my references.